So it's great to see you again, Dr. Ice, on stage, which is speaking about the TCA peels, which of course we're so excited about. So the way I feel each day I go into clinic, it's almost like I'm going to war with my clients' problem solving with their skin. And I always feel that Environ Skincare prep me by giving me the armor I need to do this. What do you think TCA is delivering or giving me to help me solve my clients' skin problems or concerns?
Well, I think the new TCA peel brings many advantages. So first of all, it's a very safe technique. So it's a low concentration with a low pH. However, you can extend the results by applying multiple layers, and it's nevertheless super safe because you see how the skin reacts. It's a very slow drying gel, in which gives the beauty therapist or the doctor all the power in their hands to maximize the result.
Okay, so it's very controlled and
Exactly.
very safe. You've been working with it yourself. What results have you got with it, or who have you seen to be the best patient?
Well, I think two major indications are photoaging. Okay. So if you're talking about like blood supply, pores, small wrinkles, also inflammation disorders, therefore we see very nice results.
Okay.
As well as on acne patients and rosacea. Okay. That's very nice.
Brilliant. So it can be used then on the body as well, the chest, the hands.
You can use it everywhere on the body, okay. Wherever you want.
Okay. We spoke before about the research you had done where skin prepped with vitamin A had shown to have 107% more collagen induced with microneedling. Is it the same with TCA peels? Would a skin that is prepped daily with vitamin A get a better result?
Yes. Okay. So especially if you're talking about photoaging, we encourage our patient at least for 1 month in advance to be prepared. With acne, it's different. There you can start immediately.
Okay, brilliant. And tell me, what about rosacea? Because Dr. Fernandez has this foolproof system where he's used the Cool Peel 2.5% once a week for 10 minutes. He's very strict about his once a week for 10 minutes. I say to my clients, get your iPhone timer out. I don't know what it is, but it has to be 10 minutes. Tell me, is it the same with the TCA peel with it? Replace it?
Yes. Okay. We would also go for the rosacea for a 10 minutes session on a weekly interval. Okay,
and tell me, will there be a home care product containing TCA from Environ?
I think the peeling we were talking today, this is for the hands of beauty therapists, okay. And because you really have to see how the skin reacts, okay. And then you have to wash it off. So this is actually for the salon treatment.
So we'll still have our Sebi mask with lactic acid for home use.
Yes, there are many peelings available from Environ for your home care. Okay. But this is something for the doctor or for the beauty therapist.
And you spoke during today's talk about the dual and synergistic effects of the epidermal and dermal by using peels for epidermal and microneedling for the dermal. Talk to us about that and how that would have a better result or outcome.
Both needling as well as peeling work on the early growth response. So they are triggering body own growth factors to be released. The peeling mainly happens place in the epidermis. Of course, there is a connection between the cell layers, so there also a reaction on the dermis. Needling works a bit deeper, like underneath the basal membrane in the upper lower layer of the dermis.
Okay, great. Now, of course, we're going to have very strict SPF use post-peel because of light sensitivity. On that note, you may or may not know that Alpha Day lotion has been discontinued from Environ Skincare. I think it was down to trying to get source an ingredient. Will there be a new SPF coming anytime soon?
Yeah, so
brilliant.
So when we are talking about sunscreen, we are talking about broad spectrum, and so there are two. It's not about like chasing the highest sun-proof factor, because that goes then with organic sunscreen, and it might it's a big discussion in the moment. However, I think the combination of broad spectrum sun cream with antioxidants is the best you can do in the moment.
Yeah, for sure, and certainly on a skin that is maybe sensitized, it's so important to keep that chemical content low, not risk irritation of the skin, and keep antioxidants high.
I agree 100%.
Okay, so reapplication every 2 hours.
Reapplication every 2 hours, as long as you go into the sun, and then you're safe.
Okay, great. And we have our rad and our rad shield. And do you think there may be any more coming?
I'm not talking too much about that.
Okay, okay, that's fine.
It's too wonderful.